And we are live. Welcome to Just Massage Therapist podcast, where we are just massage therapists. We're talking about a bunch of stuff. We're just a lot of things, and these are just our opinions and our thoughts on those things. As per usual, joining today is Cora, but our secret mystery special guest is Victoria. welcome,
Hi.
welcome, Victoria, to Just Massage Therapist podcast. We are going to give it a couple of seconds because I got to be able to go live on the Instagram. And it's letting me. We
Nice.
are now officially live on the Instagram as well. That is fantastic. So, as per always, whenever we do this, if you are joining us through YouTube, we'll be able to see YouTube and Twitch. You'll be able to see the comments right away in the chat. If you're joining us through Instagram, then I have to go back and forth between them. So if you say something and we don't get back to you right away, sorry, but I will see the comment eventually and we will get back to you. We do love chatting with you guys when you come on and chat with us. Okay, what are we talking about today, guys?
Oh goodness, you guys start.
Yeah, we literally
Adventures on the massage table.
Ooh,
Oh,
I like that. That's a great title.
Ooh.
Adventures on.
There are just way too many stories that could go with that one.
Yeah.
Agreed. So many stories.
Yeah.
So many stories.
Or insights from the RMT. We could do that too.
Mhm.
I like adventures on the massage. It's like adventures in babysitting, you know.
Adventures in babysitting. Yeah.
Adventures
It
on the
really
massage
does feel like that.
You know, I was actually thinking about those older movies, and I almost made my husband watch 16 Candles with me.
Are you kidding?
No.
That
I'm
is
really
so
close. It's
crazy.
like, you got 16 Candles or The Faculty. Which one do you
Oh,
want?
the faculty. The faculty, hands down, any day.
Yeah. I'm not a chick flick kind of a person, so it's like
I never watched 16 Candles.
Oh, it's just so funny. It's just so
know.
hilarious. It
I
just makes me
know.
so happy.
I feel
Just
like
like-
I've let down girldom and womandom by not watching 16 Candles.
that's
it's-
awful. That's like saying you've never watched Dirty Dancing. Don't answer that, Chelsea.
I have watched Dirty Dancing. Never watched
I
We're better off dead.
well, Footloose is a little bit. I like Footloose though. I like Kevin Bacon.
She's All That. Never watched it.
I can't say. I'm not a Freddie Prinze Jr. person.
Me neither.
Yeah.
Well, unless
Yeah.
he's in Scooby-Doo.
Yeah. But
I
he also
love
has
him in
Sarah Michelle Gellar with that one.
Oh,
I
wow.
like Sarah Michelle Gellar.
Yeah,
lot.
you can't not like her.
Her.
Sarah Michelle.
Sarah
Oh,
Michelle Gellar.
I have a new nickname at work, by the way. Cello.
Cello.
Yeah, because I don't like Chels, right? It's bleh. And I'm okay with Chell. I don't understand either. Okay, you guys, I don't get why the S
So
matters.
weird.
And our spa coordinator was like cello, and it just stuck.
That's funny.
Now I'm cello.
Want to know what mine is at work?
Oh, do I want to know?
I'm the meanest therapist in the clinic.
Yeah.
I'm actually starting to get that reputation too.
Anybody who needs like super deep, like if they go to the chiro and be like, we're kind of disappointed in our massage therapist, I'm just really looking for someone deep. All of them will say the same thing. We know the girl. Yeah, they just go, here you go. Have fun.
Yeah, I can't come to you.
Yes. It's like it's circulating through clients. It's not the front desk. But I've had people come to me and it's like, my wife told me you almost made her tap out. So here I am. And I was like,
love that. I love that for you.
Oh my god, that's so cool.
I was like, I didn't think I was deep, but apparently I am. I'm very specific.
Yep.
So, but
Yeah.
And this is kind of funny, and I don't know whether to take it in a bad way or a good way. I'm not entirely sure, but I had this one guy that was like deep. Like he was like really deep. And so he would go home and apparently tell his wife that he absolutely was in love with me. Yeah. And I was like, dude, like you cannot tell your wife this. Now,
Can't
Okay,
say.
so just for context, they
Mhm.
were Irish.
Oh, okay, never mind. That's
His wife came in for a massage, and like she just said to me, she goes, "I can't handle it that deep." I was like, "That's cool. Not too many people can handle it that deep."
hello, husband. Go
So
away.
I I literally just I massaged her the once. I think she came to check me out just to see, and I'm like,
Yeah,
okay. I mean, good for you, but I mean, whatever. Like, I just beat up your husband. That's all
yeah,
I do.
yeah. I beat him up.
I can't
I do
beat him
not
up.
beat anybody up.
I do.
Granted, my deep treatments, they involve a lot more of the neuromuscular stuff than they do
Mm,
the like deep stripping and
Mm.
whatnot.
yeah.
So my deep treatments are different than your guys' deep treatments.
Yeah, I use the neuromuscular techniques actually a little bit more now than I used to. I guess because I'm a bit more comfortable like using them, I guess. But like SI joints, stuff like that. Like I have so many people that come to me and they're like, I need that thing that you do. And I'm like, okay.
Yeah.
But yeah, it's one of those things like I like um mixing it up because like I mean I do like deep tissue and stuff and I love therapeutic. Don't get me wrong because I hate relaxation and I know you love it. I can't stand it. I can't stand it. I get so bored going,
I feel that. I
I
feel that.
don't feel I don't get bored at all. I just get into rhythm and it's
No.
just
yeah, I'd
lovely.
fall asleep. I start yawning.
See, if it's relaxation or something to work on, then I'm okay.
Yeah. Yeah,
But if
and
it's
that's how I am.
petting, it's like, well, go get. I don't want to pet you. Like
Yeah,
I don't want to.
right?
I
Oh,
just
Like
I want this
Chelsea, I'm
growl.
glad there are people like you out there because like I always tell those people when they come see me, like I'm not your girl, but like I got a list of people that you can go see.
yeah, well, and that's the one beautiful thing about being in a multi-modality space because I if somebody comes to me for deep tissue and they don't like my
Yeah,
point work and they don't like right, they want the stripping stuff, I go see my
yeah,
Colleague.
uh thank you. I couldn't remember the word colleague.
That's
I was
okay.
going to say
hmm
cohort. No, my colleague
yeah,
and he will 100% be able to do what you need, right?
right.
But he doesn't his light treatment is my firm treatment.
Yeah, I'd be about the same, I think, because I think my light would be like your firm. What happened to her? I missed.
Okay, sorry. Back.
That's
Um
okay.
yeah.
Yeah, like
So
I don't think I can go light. Like I think I'm still putting quite a bit of pressure in when I do light, so I don't know.
yeah.
Yeah. See, like when I do like craniosacral or myofascial, well, actually,
Mhm.
no, when I do craniosacral and I do like the transverse releases and I'm just doing like the cross hand, that's my light. But as soon as I
Yeah.
get the oil, I just, that button turns off and I'm just like, oh, there it
See,
is.
for me,
I
light
can
would be
activate it.
lymphatic. It
Oh,
would be
that's ultra
lymphatic.
light. That's ultra
Mhm.
light.
hmm And I
That's
can
all.
do that. If I'm working on somebody like who needs that lymphatic, I can definitely do
Cassidy,
light.
baby, I'm
But then I have a
downstairs. You
purpose.
can come down and
It's
hang out
like
if
then
you
I
want
have
to.
purpose, right? So
Yeah.
it's like then I can actually get into the groove a little bit better. But if it's just like basic light, I can't do it.
Yeah, you didn't mute. It was funny.
I'm so sorry. I thought I
That's
muted
okay.
myself.
I did the
I
same thing
muted my
earlier.
computer.
That's so funny.
Sorry.
Well, I think that's a good segue into what we actually came here to do, and that's talk about some cases, some things we've seen
Mm,
on our tables. And I would like to go first because it is quite
go
literally
ahead.
my first ever massage client outside of school. Okay,
Okay.
and this one is a funny one. I've got my serious one, but my funny one, um, him and his wife both knew my sister, and I was doing like mobile massage, so I would go to their homes and everything. So I'm this fresh new massage therapist. I'm going to this person's home that I've never met. My sister knows, and I know I was in my early 20s, so yeah, I was still kind
Yeah,
of
we're invincible and nothing can happen to us.
exactly. So I go here and I do end up working on the two of them, right?
Oh,
And
okay.
they're so lovely. These two are just they're the loveliest people. I got along with them famously. Oh my god, they were great. Um, the guy, however, uh, he was what is that term? Metrosexual, I think, right? Is the term
Mm,
for when you like really like yeah. So I know
brace
it's a
yourself.
weird thing to bring up, I realize, but I bring it up for a reason. He shaved his back.
Nice. I've had a few like that. Yeah.
Okay, you guys know when you massage someone who is not recently shaved, but not let it grown
Yeah.
out very far, and it's like a millimeter to a centimeter long on the back, and your
You know
massage.
me in textures, man. You know me in textures.
This was and I'm saying, I'm telling you guys, this was every week to 2 weeks. Like they would
No.
book in because he actually had issues that needed to be worked on, and like
Mm.
my hands were raw.
Oh no.
Every week, my hands would go absolutely numb by the end of it. It's like doing a sugar scrub, but
Yep.
doing a sugar scrub for 10
On your own
hours.
hands.
That's how
Yeah.
it freaking felt. It felt like giving a sugar scrub for 10 hours after coming away from that. Like I've had my fair share of really hairy guys and like really hairy legs on girls, guys, whatever, and you get hairs on your hands. I've had my fair share of that.
Mhm.
That's whatever. It happens. This it was traumatizing. My hands would be red and pulsing by the end of the hour and a half because he always did an hour and a half.
Mm.
It was
Oh my
so
God.
bad. Oh my god. Uh, really cool people, and I loved everything, but like, his legs were always smoother than his back,
That's so weird.
Well,
right?
they're
His
easier
back.
to
Yeah.
shave.
Oh, that is
I
true.
would rather massage men who don't shave.
Yeah, please, please, please,
Just let
please.
it leave it
Either
be.
like or like go get waxed, man. You want to do that?
Yeah.
Fantastic. Go get waxed. Nair it. I
Yeah.
don't care. Just don't shave it because owie to us. Owie. It hurts so bad.
So I'm gonna hijack off of that
Oh,
actually.
oh,
This
okay.
is
Your
like
turn.
this is like a me thing, lesson learned. But in massage school, no gel nails, no nail polish, right? So when I
Mm,
Yeah.
graduated, I'm like, well, you can't tell me what to do right now. I'm my own person. So I went and I got gel nails. It took so long for us to figure out how to get the gel on so the oil didn't take it off, how to get the nails rounded so I wasn't scratching the clients, leaving nail marks.
Okay.
And then
mhm.
I had a hairy back and my nail was lifting and the hair got
Yes.
underneath the nail. That was pulling that hair out was the grossest sensation I have ever experienced. And that was the last day of my nails.
Yeah. Yeah.
True story.
I can quite imagine that one.
I've heard this story so many times, and every time it's funny. Oh my god, it's so good. Oh.
Boy. Yeah, I don't know.
Oh.
I have some funny ones, but some inappropriate ones that happened that we cannot discuss on here.
Oh, got it.
Yeah.
Yeah.
But
DM us for other details, people.
uh, yeah, there's some funny ones, but it's just like what?
Well, now
Hmm.
you got to tell us at least one funny story.
Mm. Okay, there's a reason I don't like white sheets.
Okay, do tell. Why don't you like white sheep?
Okay, so back when I first started doing massage, I was working at a spa, and of course, at the spa, They use these crisp white sheets because they look so fantastic.
Hmm.
And I refuse to use anything that is white, gray, anything that is light ever. The reason for that is because I had this one client and I know him very well. So, and like, and I say this as a cautionary tale because I do know him. He's absolutely an awesome human being,
It's delightful.
but he is delightful. When he came for a massage, he was wearing a satin red bikini, and I could see it through the sheets. And so I refuse to ever have anything see through. Nope.
That's so
Mm.
good.
That's fair.
Yeah,
I get it.
there is like, yep. You
We
know,
use
just
brown.
I think we have like black ones that are our clinic black and red, I think, are the good ones. We even have some sage colored ones which are really nice.
Yeah, I remember. At the one in town, not in the city. We had like
Hmm.
4 or 5 different colors, didn't we? Yeah.
Yeah, because they usually order them at different times and it depends on what's available, right?
Yeah.
So I kind of like that they don't have to like, I don't know, use the same color because I use two different type, like a top sheet is a different color than my bottom sheet.
Yeah, I actually do like doing that to help people, but you know what I've started doing instead of that's another funny tale. Instead
I
of
was gonna say there's a whole bunch of funny ones for that
just
one.
instead of just folding down the top one, right? I'll have it folded
Mhm.
down, and then when I'm explaining everything to them, I will grab the top sheet and lift it up.
Okay, so I have done that, and they still managed to get under both of them.
It's so funny. It's so
Like I
funny.
just
Oh my
I
god.
don't understand it. Like I do love that we have fitted ones now, so there's less of that, obviously. But
I
yeah, like if I do like two flat sheets, oh yeah, yeah, like I'll pull it back. I'll even show them, get underneath, like blah blah blah. I am a very visual kind of a person, and they will still manage to get under both of them.
The thing.
That's the thing. Although, because I do all of mine face up, I start face up instead of face
See,
down.
I don't.
Yeah, I because
I
I
don't
do
want
that,
to.
I have a pillow, and the pillow
No offense
covers
to
over
clients,
top
but
of
I
it.
don't want to see their face.
That's so evil.
I just don't.
But because
I
I
don't
do
want to. I don't
that,
want to walk in and see. Like I just no.
the pillow sits on top of the bottom sheet. So for them to have to get underneath, they'd have to knock the pillow off. Which
Fair.
I'm sure that
That's
there
fair.
are a few who will still do that, but I haven't had to worry about it just yet. You don't want to see their
Mm.
face, you weirdo. Cora, what about you? What do you have any good funny stories other than the traumatizing nail one? It's traumatizing.
Not really that come off the top of my head at the moment, actually. I'm trying to think of funny ones.
Yeah, I always have good funny ones. I always love the ones where we tell them to, lie face up and they lie face down. Or you
Yeah.
tell them lie face down and they lie face up.
Or
Or they
actually,
get on top of
I
all the sheets and they don't put
yeah,
any sheets on.
uh,
yeah. So they're completely just laying there in their underwear, just like face down.
Yep. It's
It's a
like,
thing too.
I have this one guy, an older gentleman, and I swear to God, he does it just to spite me. I swear he does it just to spite me. Like he's been coming to see me for years, like years. Okay, this isn't one, two appointments. This is a lot of appointments. And every time it's the same thing. Face down in the face cradle underneath the top sheet. Pretty self-explanatory, you'd think. But every single time that I come into the room, he's on top of the sheets in his underwear, lying face up.
oh man.
I just, I
And every
don't,
time you have to tell him to turn over and you have to put a sheet on.
And I have to rip the sheet out from underneath him just to cover him up. I'm like,
You know what you
I
should do?
just
You should just grab a sheet, and when you walk in,
Just poof.
just put it
yeah.
over 'em.
Happy Halloween. Now we're a ghost.
Just only ever put one sheet down for him, and then just
Mm.
come in with it over your head, so you don't have to see it.
No, then I think he'd be confused. He'd be like, "What the hell?"
So
Yeah,
maybe he's
that's what you're
spontaneous.
supposed to do. Yeah, I don't know. I swear to God, like he does it just to. He's one of those guys that I don't think that he likes women telling him what to do.
Mm.
When he talks to me, is like the little stories and stuff, and I find him hilarious. I do find him kind of cute, but like there's times where like some of the stories, like I have to go, yep,
Mm. Mm-hmm.
yeah. It's just one of those like, okay,
Oh yeah, yeah. We've all got some of those. I have this lady that comes in who does not know how to manage her volume.
Mm.
oh
I think
yeah,
it's
that's
all
tough.
of the drugs she did in her youth that she tells me about.
Oh,
Uh
she's
huh.
oversharing.
She is an oversharer, and
Mm.
she says the almost racist comments, but she does this thing where it sounds like she's about to be really, really racist, and then she says something wild, like, okay, I'll give you the best example that I have actually. She said, "I'm white, you're white."
Oh my God,
That's the first thing you think,
no,
right? Is gonna be, "Oh my god, you're gonna say something super racist right now, and I don't know."
yeah,
You know what she says to me? The
what?
worst people that I get, because she works at a box store on till, right, at the cashier, and she's like, "The
Yeah,
worst people I get are rich old white ladies."
what? You know what?
Like, I'm sitting there just prepping myself so hardcore for this hugely racist statement, and it's like rich old white ladies. Jesus, please help me right now.
I have this. Like I have like a few older ladies that come, and there's this one little old lady, and I've been seeing her, no word of a lie, since 2 weeks after her husband died.
Oh,
She came to see me, and she's like, kind of sits down, and she like literally, this girl's 4'7". Like we're talking compact, tiny, and she says to me, she says, "My husband died, and you know, I just really need a massage." I'm like, sure. She comes to sees me when she has a tough time. So
mhm.
every time that, there's an anniversary or Christmas or something, she comes to see me. And it's just for the touch and the chat. We talk
Oh,
about gardening. Yep. We talk about gardening. She sits there and she's just doing her garden in the back right now, getting rid of the thistles. So we have a great chat.
oh my god, that pulls the heartstrings right now.
It does. Yeah.
I
Pulls the
love
heart.
I love people like that.
Oh yeah.
Oh, I have one thing that I wanted to say. So, like back about 15 years ago or so, when I was first kind of out in the thing, uh, one of the biggest pet peeves, and I want to like ask you guys this. One of the biggest pet peeves that I have is when people tell me, "Oh, like I heard, it's old age," and they're like 40. Okay, so one of these clients that I had at a spa, this lady, I would have said, like, by looks, I would have said about 65 ish. She gets on my table. She was a dancer all her life. She has scoliosis and she's managed to maintain it very well. She's done like remarkably well for her condition, and her muscle tone was absolutely amazing. Like I would have said she was probably late 40s, early 50s with the muscle tone she had. Like it was incredible.
Hmm.
And so about like, and I don't ask people, like I'll look at their file to see how old they are, but I generally don't like get there. But this lady, I was curious. And the more she talked, the more she, whatever, I was like, ma'am, I need to ask you a question. And it's because I'm curious. Um, how old are you? And she said, how old do you think I am? And I said, I don't want to offend you. Um, I really don't. But I would say like early 60s to 65. And she started laughing. And I was like, what? Like, what am I missing here? She was 85. 85. And this woman had muscles, like I'm telling you, incredible muscle tone. So the idea to me that people think that just because you're a senior citizen or just because you are in your 40s, that you cannot have muscle tone or that you can't be strong pisses me off. Like it pisses me off because you can, and you like you are capable of having it. It drives me
For
nuts.
sure. And with that, it's like your self limitations.
Yeah,
Just
100%.
you
Because
say
if
that
you sit there and tell yourself, I can't do this, then you can't. You
you've
basically just
already,
told yourself you can't. Hmm. It's huge.
Well,
yeah, it really is.
Vicky and I have said quite a few stories. Corey, do you want to lead with another story? Or do you have any other ones in your pocket yet?
I'm still trying to think of, like, I guess I have, like, they're not really funny ones,
Well,
but I
no, they
have,
don't have to be funny ones.
like, I have one where it was like a red flag gone wrong, kind of.
Oh, had a
Like,
few of
because
those.
I had this client and he came to me and he had stubbed his toe, right? And so he came to me for a sore leg. Now, some background on this client, he was living his life. Okay, he was living his life as he's allowed to do. So he was not on the ball with his meds. He didn't really care. He was living his life. He was diabetic. He had peripheral neuropathy.
Mm, yeah,
And then he came to me with because of a stubbed toe. And he said, I really
yeah.
need you to massage my legs. I looked at his leg and I was like, man, this is like a strawberry. Like, I'm not touching your
Mm.
leg. And he's like, well, what should I was like, what are you doing to your leg? What have you been doing for it? He's like, I've been putting heat on it. And I was like, well, you should not do that. So
No.
I did. Yeah. I was like, you should not do that. I was like, so I need you to go to the doctor. And he's like, well, I'm here. And I was like, well, if you want me to massage you, it's not
Oh,
what you're wanting. Like, you're going to get like Reiki. You're not getting anything that's going to increase circulation. Then he's like, that's fine. So that's, I was like, but you have to go to the doctor because I'm not going to treat you unless you go to the doctor, because home sign was negative though. So I had nothing concrete to be like, hey, this test was positive. You need to go because you have a DVT. It was completely negative. But what actually happened, he did go to the doctor because I straight up refused treatment. That stubbed toe got infected because of his peripheral neuropathy. He wasn't aware. It actually went septic. He was going
yeah.
septic.
I was gonna say.
And so they thought they were going to have to amputate from the knee down. But as it turned out, he just lost his toe.
He's lucky.
That's
Yeah,
so
but
lucky.
he called me after and he's like, man, I never would have went to the doctor if you wouldn't have made me go to the doctor. And I was like, well, I'm glad you
So,
went to the doctor because that would have been a very unfortunate
you,
situation.
could you imagine?
I'm sitting here like ugh, scared, chewing my
Yeah.
fingernails, scared for that client. Oh my god.
Yeah, it
So
was.
that kind of leads into like one of my little moments. So I had this long time regular client. She has regular headaches. Like we're talking like all the time. This girl every day, constant headaches. So I was treating her shoulders, neck, all the time, just trying to kind of alleviate these things so that they didn't get into migraines.
Yeah.
So we'd had this long term like discussion about her headaches, and this one day, it was right before Christmas, and we got into this conversation about her headache. She said she'd been to the hospital a couple of times and stuff, and I said, "Well, just explain this to me. Like what it like explain it like I'm an idiot, but I don't know what you're talking about. Like
Okay.
just talk to me about this headache." And she's like, "Okay." She said to me, and I quote, "I've never had this headache before." My hands came off of her neck so fast, and I said to her, "You need to go to the doctor. You need to go to the hospital, and you need to push them until someone listens to you. And I want you to say that exact sentence every time you talk to a nurse, you talk to a doctor, I don't care. I want you to say that every single time." So that was about a week before Christmas. She had booked in with me for Boxing Day, which I got a note stating that she was in the Calgary hospital having surgery for an aneurysm. I was like, yep. And she's had a couple.
Oh my god! Like we're
Yeah.
doing this right before Halloween. This is the perfect moment to talk scary stories. That is a scary.
Right?
That is a
That's
terrifying
terrifying.
story. Like we
Yeah,
know, and
she
any good massage therapist knows that there are some red flag headaches, and one of them is I've had headaches all my life, but nothing like this. This is the
definitely
worst
this.
thing, and it's never felt like this before. That is the one of the
Yep.
biggest red flag headaches.
Yep.
Headache
Yep.
with a fever,
And
that's a big one. Headache with a stiff neck,
mm,
worst
yep.
headache you've ever felt before. Like red
Mhm.
flags.
Yep.
I don't have anything as intense as that. One of my regulars, I found a lump. It felt like, honestly, it felt like a lipoma. That's all it felt like.
No.
Was just
Mhm.
like a connective tissue lipids all connected together. And she didn't know it was there. Found it. I think it was beside like L1, maybe L2. So I was like, this could be detrimental if not dealt with. So like,
Mhm.
go and get this checked out. She didn't know it was there. I see her 2 weeks later and she's like, well, apparently I've talked to my doctor about this before. And the doctor was like, no, we'll keep monitoring it, but thanks for bringing it up again. So I'm going to just,
She forgot she had talked to
she
her
forgot
doctor.
completely. Uh, so yeah,
That's awesome.
she's one of my oncology patients as well. So
Mm,
she's in remission. So of course, any little thing we're on top of.
Yeah.
But yeah, apparently that one it was just a yeah. Oh my gosh, that transitions us into the whole next segment, and that's the serious cases. So do you guys
have
have?
you ever felt? Okay, so the very first time I ever felt this, I was like, I had a moment. This is why I don't like to see people's faces. Okay, I'm expressive. Okay, there is no way around this. And when I find things that I don't like, there are some. I would scare people. Like they would literally think they were dying. Like this is so.
You have ADHD face.
I do. So there's a client that I had, and he comes in. He gets a back massage all the time, and like I think it had probably been about a year since I'd seen him, and so I don't recall anything being on his shoulder blade. But when he came in, he had this squishy ball mass on his shoulder blade.
And he didn't notice
It's
it?
a cyst. I didn't make a note of it anyways, and if I did notice something, it was probably small
No,
at
but
the
he
time.
didn't notice it?
Oh no, he noticed it. He
Oh.
knew full well it was there. I did not. So when I'm massaging over it, I'm like that's squishy. Like what is that? And he told me what the actual name of his. I can't think of what it is right now, but he told me he was like, yeah. He goes, the doctor says it's like nothing to worry about. Blah blah. I'm like, well, I'm assuming it's not because it's not hard. But I'm like, I don't think I've ever seen anything that big before. And it was like,
Oh, one of those
yeah,
big lists.
yeah.
Yeah.
Do people not just
Yes.
get that taken care of and cut out? And, like,
It costs money to do that.
I
does
feel
it
like
really?
it just depends. because it's
Yeah,
cosmetic.
because it's not life threatening of any sort, so it costs money.
Yeah, like I had a client whose whole back was like a giant lipoma one time,
Oof.
and he was one of my very first clients actually from graduation, and like there was maybe his whole back he had it through like the lump. It was in the lumbar region, it through the thoracic, and it was just like one giant C.
Like, does that not
And
affect the muscles at some point?
well, I felt I I could feel the tension like with the myofascial. It was all pulling in that direction.
Mhm.
Like I definitely felt the restriction coming from there.
Yeah.
But yeah, no, it was just he had it for years and the
Wow.
doctors weren't concerned, and it's just cosmetically unappealing.
Wow.
Mhm.
That's an interesting case.
Yeah, it was
Hmm.
just one of those. I was like, what's happening? And I was like, this is,
Yeah.
are you aware? Like, I'm sure you are, but like, you know? And he's like, yeah, it's just a lipoma.
I think probably one of my favorite clients, like client cases that I've ever worked on, was a mastoblastoma patient.
Ooh.
Yeah, it's a rare, like super freaking
Mhm.
rare of the cancers. So the mast cells and all that fun stuff. So um, we can't we can't do things like cupping. We can't use basically any essential oils. There's very few that we're allowed to use. I can't do a lot of heat with her. It's pretty crazy what we can do, which we have a lot of fun regardless. Um, when I started treating her, she had been well in remission, but it's not something that just goes away, right?
Mhm.
It's something that she has to be very conscientious about every time she gets an injury, illness, anything. I got her 3 months after she had a knee surgery because she blew out her knee. So yeah,
Ooh.
we've been very vigilant, doing a lot of MLD and stuff, but we are about at the 6 month mark. You know what that means. I can start getting into the scar tissue. I am
Yeah, like only you would like be like just like, oh.
I am so we've been talking for like weeks and weeks and weeks, right? So for the past 3 months of treatments, and she usually comes to see me every 2 to 3 weeks. So 3 months of treatments where we've been reducing the swelling. She's been going to PT. She almost has full range of motion back in her knee because of everything we're all doing. Like she is doing
Nice.
such a great job. When I first met her, she was still on a crutch. So in 3 months, she's gone to walking fine, almost full. Like I'm just so proud of her. But I'm so excited to finally get into scar tissue. I actually think her 3 month or 6 month mark is this coming week,
Oh,
and then
that's
I've got
exciting.
her next week. I know.
Nice.
That's so
Oh my
exciting.
god, you guys, I'm so excited, but also terrified a little bit because mastoblastoma means that I can't go in and do our normal friction crazy around the edges, can I? I can't do that.
You can
Nope.
spread. You can do the
I can do the
spreading,
spreading, I can do all that stuff, but I can't get in there.
but you
So
can
she's gonna be
come
a
in and do the point, like the myofascial. So you can
mhm.
come in and just like do the spreading with fingertip spreading in there.
Oh yeah, I'm going to do all the things I'm
Yeah,
allowed to do, but I'm not allowed to cause inflammation.
Nope.
And
it'll work
no,
out.
it
It'll all
makes
be
me.
good though.
It's going to be a completely and utterly new experience for me.
That's so good.
I'm
That's so
so
good.
excited, and she's so excited, and she's like just the sweetest person. She's a nurse, and she's just. I love her so much.
I had one of my biggest success stories at Movement Chiropractic. So I have never seen this before because, like, for me, I usually get people in the much later stages. Um, so I had this lady come in with frozen shoulder. Now I got her in the freezing stage,
Holy
which is
smokes!
very rare. She still didn't at this point know what she had. So she was in so much pain when I first started treating her that she couldn't, it was very hard for her to lay down, to have like her shoulders hitting the table. We had to adjust, we had to modify, we had to do everything just to get her to lay on the table. And that started like, and I'm saying months. We got her, like, she was told by the doctor a year. We were told a year. And I said, if because you got this so soon, we could probably take that down. And I'm like, as long as you're vigilant with the things that, like the exercises, the massage and everything, I said, I can't guarantee, but I said, we can, like, I'm going to wait for the frozen stage at this point. And then then we'll know more for sure. So she went into the frozen stage, but because of everything that we did in the freezing, the frozen stage was almost non existent. She had it for a very limited amount of time instead of being stuck there for months, which we all know that, like, if they get stuck in that frozen stage, it's really hard to get them back. And she was like non-existent. She would basically went from like freezing and the pain, the excruciating pain, to all of a sudden I could touch her. She was limited in her range of motion, but I mean, I was pretty impressed by the motion she had. We were doing wall crawls at this point, just different little things. And then all of a sudden, within weeks, like I'd say probably 3 weeks, she went into the thawing phase. And from there, we got her like, it was incredible. I had never been at the first stage of things. I always get them when they're already frozen. And then it's like you're trying to like
Play catch.
reach back into what they used to have, right? So this was pretty incredible.
That's
And
awesome.
total time from when I saw her in the first time till she was basically done with me was 5.5 months.
Wow.
Wow.
And I would say that the last couple of treatments were only just to kind of get it maintained.
Oh my god, that's so freaking amazing.
Yeah, that was one of my like oh my god moments. Like I was just like this is why I do what I do.
Yep, I love my job.
Yeah.
Hmm.
But it was incredible to see it like and I don't begrudge anybody, but the frozen freezing stage, Jesus, like I can't even imagine. Like some people go through an insane amount of pain.
So much pain.
Insane. And she somehow made it work. She came in, she lay on my table, she forced herself to lay on my table. I felt so bad. I was like, a couple times we had it seated because it was the best way to do it. Just whatever was comfortable for her. And a lot of biofreeze after.
Oh yeah, I've been using the biofreeze like crazy for my
Oh
PCP.
yeah.
Yeah,
Stop using.
I'm getting better. Oh man, these were good. These are some really good stories. Oh my god, I'm loving this today.
Yep.
We should plan to do these every few months. Just like
Should.
yeah, just come together and talk more stories. I would
I got
love to be
20
able to.
years of experience, man.
Yeah. You got 20, I've got 17. Cora, you're at what, 15?
15, yeah.
15.
But
Yeah.
Yeah.
just full time now. It was always a side gig before.
Nice, right?
Yeah. Oh my god,
Yeah.
it's so wonderful.
But I would have to say though that my best success story
Mhm.
Hmm.
is actually when I was also fresh out of graduation, when I was still trying to work with children.
Mm.
I was working in a care home with some clients that had cerebral palsy.
Lovely.
And one second, baby, just one second. Thank you. And they were pretty advanced, and there was like a lot of different underlying conditions associated with it. But lots of them were really tactile defensive.
Yes.
And it at first, when I would come in there, they absolutely wanted nothing to do with me. I wasn't allowed to be in their space at all. And then I
Yeah.
eventually turned into a racetrack for their cars.
Nice.
And then it turned into them seeing me and they would just like sprawl out and they'd give me their hand, they'd give me their foot. And then they came done here, then here. And then they would just direct the treatment. But they actually,
Like that.
yeah, that was probably the biggest success story that I have. And it's just, yeah, it was just amazing. I think about
Children
what
are amazing.
you really
Like they're
are.
just so amazing.
Yeah, they
Yeah.
really are.
Yeah. And
I
then just,
honestly could do half-hour treatments just on children. Yeah.
yeah,
I've worked
something.
with autistic kids. I
Yeah.
really like working with autistic kids.
They're so fun. They're
I
so
don't
Because
have
fun.
a
when
lot
they
of
accept
experience
you,
there.
and the bubble, it's incredible. Like, yeah.
Yeah. No, it's amazing. That was actually my big drive, actually, is I wanted to work with autism. Like that was my focus. But then I had kids and the focus shifted.
It usually does.
Yeah,
But
you're still kidding.
Yeah.
yeah.
Oh, jeez. Only had one opportunity to work with an autistic teen, not even child, teen, and I've only worked with a few kids ever. It's never been a focal point for me, but it does sound like fun.
Oh, it's so fun.
I think
It's
I
just
think the thing that gets me about autism is like they're so like the touch, right? And one of the easiest ways to get them used to it is to take them for a massage. And like a lot of the times the parents are there with them and it's always a safe environment. Like and I always have a chat with them first. And then they can wear their clothes if that's all they want to do. I doesn't matter to me. And then we eventually get to the point where they're very comfortable and then they'll lay there and they'll just let you massage their back and their legs and stuff. But it gets them to the point where touch isn't so scary to them and it doesn't
Mhm.
send them into an overstim,
Yeah.
right? I think it's so beneficial for autistic kids.
Yeah.
Well,
I agree in that.
it's cool.
Yeah.
That's really cool.
Yeah, like at one of my previous places, I was actually working. Well, there was an art therapist in there,
Mm.
and I was really hoping that we were just going to be able to start collaborating because I
Mm.
Mm.
saw some of the people that were coming through, and I was like, yeah, I want to work with you. I want to work with them. But life had different plans were laid out for me, I guess.
Yep.
That
Oh my
happens.
gosh, we can all. You know what? That would be another one of these days to do. Life, how it how it changed plans.
Dear
I know
Lord.
the three of us all have some wild stories when it comes to that for sure.
Yeah, I'm
Yep.
looking for the whispers now. The Durango's not there to tell me about the roars anymore.
Oh right, yeah. Well, hopefully you don't have any more roars, and all you have now are whispers.
Yeah,
We're gonna put that out in the universe.
well, can we go listen to them now?
Right?
Yeah,
Go listen to
yeah.
the whispers.
Listen to them before they become roars, please,
Yep.
people. Oh, oh.
Yep.
Well, this was a
I
lot of
hear you.
fun. We are coming up to the end of our normal episode length, so we're gonna cut it up. Cut it up. Cut it up. Really? We're gonna cut it up here.
Okay.
Yeah, we're gonna cut ourselves off here. I think. But yeah, keep giving stories in your heads, and we'll do this every few months because I think it'd be. This is always a fun one. I always love doing this. Yeah.
That sounds like a plan.
Deal.
Oh, it sounds like the kids are calling.
Kids are calling. My husband is part of that, right?
Cool, cool.
Yeah. I love my quiet house.
Yeah, I believe it.
Not even my dog was bugging me. He disappeared.
Hiding downstairs, maybe.
Probably.
Yeah.
Let's see. Mine are super butthurt right now because I am so done cleaning up the pee right beside my entrance when I come upstairs. So they
Yep.
are currently staying in the kitchen. So
Nice.
they're so butthurt and they're so like timid. Like, look, I'm a good boy. I'm a good boy. But then I'm still
For
stepping.
now.
Yeah.
Yeah,
Well,
we're still
now
stepping
you are.
in pee. They're just yeah. Anyways,
Yep.
I love my dogs.
Yes,
Very
animals.
much. But
Yep.
Our
I hear
animals
ya.
are always crazy like that. All right. Well, this has been absolutely delightful, but we are going to do our sign off. We have been just massage therapists, and we hope that you enjoyed and keep tuned on our social media and stuff because we are going to be announcing our next courses coming up very soon. Probably, I don't know. What do you think? Another couple of weeks before we announce what's going up?
Yeah, we're just waiting on an email.
Yeah. And
Yeah.
once that comes through, we will post everything for you guys. So we will see you in another week. Our time is going to be changing probably a half hour later. Am I correct? 8:30 instead of 8 o'clock. We'll chat. Yeah, but I'm pretty sure it's going to be that. So
Time
I've got,
change for you.
yeah, so I've got a time change coming up, and I won't be able to. Yeah, I won't be able to start at the normal time. So we're going to try and start 8:30 instead. So yeah. Otherwise, it was really lovely to see you all. It was really lovely, Vicky, to have you joining us today. This was
Thank you.
fantastic. If anybody ever wants to go see her, she is working through Movement Chiropractic.
Oh, excuse me.
I love those. Vicky, I don't think you've ever heard one of those before.
No, what is that?
That's my hiccup.
Okay.
She's got these wild hiccups. They make me so happy. And I thought when I left Saskatchewan that I was gonna, not be able to hear them anymore. And then we are doing this, so I get to hear them whenever the heck I want.
Nice. Love
But yes,
that.
Movement Chiropractic. If you want to go and see Vicky, she is there. Cora is now working over at a LifeMark in Saskatoon.
Nice.
Both of them are in Saskatoon for that. Vicky's also out in Watrous a couple of days a week for Movement Chiropractic. If any of you are watching from California, come see me at El Blue.
Sorry. The hiccup just made me remember a story.
Okay, one more
Oh,
story.
these two.
Okay. So you guys all heard my hiccup. I used to
Yeah.
tell people right off the hop. Okay, I have obnoxious hiccups. They might come, they might not. They used to be way more frequent. So I found out that people weren't relaxing because they were waiting for the sound to come out of me. Okay, so they're just like waiting for the sound. So I stopped telling people. And because sometimes
And then you scared the bejesus out of people.
I did. It was a hot stone massage. Okay, so I was over at the crock pot. The client was a nurse. I was over at the crock pot getting stoned, so I was maybe like about a foot away from the table. I hiccuped before the hiccup was done, and I could explain to her what happened. She was off the table, ready to give me CPR. True story. And I was just like, oh my goodness.
Oh my god.
That happened. She was like, and she had completely dressed down and she was ready. I knew I was safe in that treatment. And so I was very grateful that I was safe. But it was a situation.
I love that so much. Oh my god.
She got a discount.
Yeah. Yeah.
Oh my god, that's so good. I love that so much. Oh my god, I think I'm crying.
Oh
I was getting a
god.
sugar scrub once, and I slipped off the stool and landed like so hard. And this poor woman, I actually haven't seen her since that day. I think it's
Nice.
because she went on vacation. I'm actually pretty sure she was getting the sugar scrub to go on vacation. But yeah, I got you. I got you. The embarrassing stories. We should think more of those and figure out when we'll do that next
Mhm.
time. Oh my gosh, that's so funny. All right, we are going to sign off. Have a